Okay, so good evening everyone. We are here for our MDS 360-degree INICET PYQs discussion. I hope my audio and video is fine. Then we'll go ahead with the session. Okay, so I have a good to go ahead signal from the backend. So today, good evening Nikhil. So I think I'm meeting after quite some time on our YouTube channel. So I'll introduce myself Dr. Rajul Agarwal. I'm the orthodontic faculty at DAMS. So today we are going to discuss the orthodontic questions from November 2023 INICET exam. Okay, so starting with the session, we have people joining up. Okay, so good evening Dr. Sweta. So I discussed it long back when in November 2023 this paper, the recall paper. Okay, the paper at that time was quite easy. So what pattern we have noticed in the INICET exam is that May exam is quite difficult as compared to the November exam. So November exam, the questions are quite easy and straightforward as compared to the May exam, but although the seats are more in May as compared to the November exams. Okay, so that balances it in itself, and the cutoff also increases since the exam becomes quite simpler in the November session. Okay, nevertheless we cannot become relaxed since it's the November exam, and our study pattern should now focus upon giving full course test for your upcoming exam. No subject wise test. Now every week minimum 2 to 3 full course tests in that same exam timing and pattern should be attempted, so that your mind gets accustomed to see 200 questions mixed up of all 19 subjects which you are going to face up in your November exam. If you keep on giving subject wise test and wait till the last moment, October end or November first week, to start giving your full course test, then my friends, your seat will be delayed. Okay, the aim with which you are giving will be delayed. So my request to you all is, those who haven't start giving it, it's high time. Minimum 2 to 3 per week. I think it should be now September end, so 3 per week full course test should be given, attempted, so that your mind gets accustomed to the exam pattern. Okay, so beginning with the first question, leeway space of Nance is due to. Quite easy question, as I told you beforehand only. November exam quite easy as compared to the May exam. Space difference between primary and permanent maxillary canine, space difference between primary and permanent incisors, space difference between primary canines and molars and their successors, and space difference between primary and permanent molars. So yes, C, D, E, 3, 4, 5. C, option C is the correct answer. Okay, so as I have told you before also, We are not here just to discuss the correct option, which you all know that what is leeway space, what other questions can be found out of this. Okay, so in maxilla, the leeway space is 0.9 mm per segment, it is 1.8 mm in total. Mandible, it is 1.7 mm or 3.4 mm in total. Leeway space, since most of this leeway space is contributed by the deciduous second molar, it is also known as E space. Once again I am repeating, since most of this amount of space is contributed by the second molar, that is the deciduous E's, it is also called as E space. So अगर एग्जाम में E space करके क्वेश्चन आए, don't think that is something new which they have asked. Okay, next is this dimensions. This is the correct and only dimension. Any value other than this is not correct. If in exam you get an option which is nearby to these values, then mark that, otherwise these are 100 to 100% correct, because in your previous year question bank of pulse there is a question in which the values are slightly different, so you have to mark the answer which is nearest to these values. Next, what is primate space? So primate space is the space which is located between the lateral incisors and the canine, whereas in the mandibular arch it is located between the canines and the first molars. So in lower this it is this, and in upper it is this. It is also known as simian or anthropoid space, and primate space in upper arch is also known as bomb space. Okay, so space difference between primary and permanent canine, nothing. Space difference between primary and permanent incisors, what it is known as, if anyone can tell. This phenomena is known as incisor liability. And how it is taken care of by, you all know, proclination of incisors, okay, decrease in the incisal angle and all these stuffs. Space difference between primary and permanent molars, nothing is of term as such. Okay, so we have eliminated other options, and what other questions can be found out of this. Any doubts in this particular question? Development of occlusion, a very important topic, self-correcting anomalies, application based question and value based questions. Next question, first sound produced by the child. Nimisha says option B, Nikhil also says option B. So again, quite easy question. The first sound produced by the child is bilabial sounds. So what other questions? Why bilabial? Because lips are developed first. So another question, the development occurs in anterior posterior direction. Lips, why they develop first? To aid in suckling of milk. That's why the sound also developed first are the bilabial sounds. So these are the components of the speech. First speech sound, and last sound which requires develop is the R sound, which comes by the age of 4 to 5 years. This question was also part of your 2025 INICET exam, the speech sounds and the related malocclusion which is occurring. Okay, so this table should be remembered by heart. AOB stands for anterior open bite and the associated problems with the for sounds associated with it. Okay, so when a maxillary removable appliance, okay, made up of acrylic is given, so what happened, acrylic covers part of the palate, so the sound which gets affected are the lingoalveolar consonants, and the normal speech is achieved within 24 to 48 hours. This was your PYQ question from your SR exam of PGI Chandigarh 2024. Okay, so the normal speech is achieved within 24 to 48 hours in such patients. So clinically you have to assure the patient that it will take 1 or 2 days for you to achieve your normal speech whenever you're giving a Hawley's plate or an acrylic plate to such patient which covers the whole palate. Okay, so nowadays in prosthodontics also you would have seen that the acrylic part is trimmed as much as possible so that the palate is exposed and only the vertical ridges are covered. Okay, moving ahead, identify the appliance. Herbst, Jasper jumper, Rito, Forceps appliance. Any doubts until now in the previous question can be asked. Again, I have no objections in repeating any point. We are here so that we are able to help you out for your upcoming exam. So yes, Herbst is the correct answer, and this is the most out of fixed functional appliance. This is the most commonly asked appliance. Next commonly asked is the Jasper jumper. Okay, so this is the classification table of fixed functional appliances. Okay, and this is the Herbst appliance. Any rigid fixed functional appliance will have these kinds of metal rods present, and the most commonly asked is the Herbst appliance out of all of in their exam. Okay, next commonly asked, as I've told you, is a Jasper jumper, which is a flexible fixed functional appliance. So how will you identify it? Any appliance which with this kind of nylon or vinyl coating on these plunger. So that what was the advantage of flexible fixed functional? They permitted lateral movements as well. And hybrid will be a combination of rigidity as well as flexibility, so it will have such kind of a spring present. In that image you have to look for such kind of a spring along with a metal rod. If vinyl coating like this, colored coating present, आँख बंद करके mark it as flexible, and most commonly it's Jasper jumper which is asked. 99% Jasper jumper out of flexible. Other examples are also there, but maximum time only Jasper jumper is asked. Rest images I've already shown you in your classes, all are available on your app as well. You can go through them. Any doubts? Otherwise we'll move ahead. Identify the appliance. A very simple question. Nimisha says option A, bionator. So yes, the correct answer is option A, bionator. Very easy to identify. Activator will have the acrylic covering present here. If this acrylic covering is removed and this type of a thing is present, this is known as a coffin spring. Then this is a bionator. So there are three types of bionator. One which I just showed is a standard bionator. Next is a open bite bionator. It will have a high occlusal blocks present, means the occlusal blocks thickness will be more. And lastly, the reverse bionator given for class 3 correction. So how to identify? This arch will be present in the lower compartment and this bar will be reversed. Okay, so sorry, this arch will be facing like this forwardly, this coffin spring, and this bar is also reversed. So that will be a reverse of class 3 bionator. So just remember these images. This is the image of activator. This is a twin block appliance. Remember this occlusal cut at 70-degree angulation. cat lens appliance का cut ध्यान रखना है most commonly, and this is the FR appliance. FR की classification must to know all 5 types. A PYQ already has come on this FR subtypes, multiple answer type question के correct answer type question के in the exam. So that's it from myofunctional appliance images. Okay, any doubts? Yes, we'll move ahead to the next question. Hyperactive mentalis activity is most common in which type of malocclusion? Nimisha says option B, class 2 division 1. So yes, option B is the correct answer, class 2 division 1. So mentalis is a muscle which is present in the lower lip. So because of proclined upper incisors, what happens? Increased overjet, inadequate lip seal, so the lower lip activity increases so as to provide the lip seal. Okay, so that's why the mentalis muscles are active. Whereas in class 2 div 2 the upper incisors are retroclined. Okay, the overjet is decreased. Okay, other characteristic feature are this mentolabial sulcus which is deep, whereas it can be deep or normal in class 2 division 2. So a very important table for your exam. Okay, so we'll have a golf ball appearance of lower lip. So this is the golf ball. If you can see, there are multiple depressions which are present on it. Similar kind of this is how you clinically diagnose hyperactive mentalis. See this. So another name for this is golf ball type appearance of the lower lip. Clear? So next question. Which of the following analysis does not uses mandibular incisors? Tanaka Johnston, Moyer, Sukaba, Stanley Kerber. So in the recent few exams I have seen that mixed dentation analysis. One question is a must from this topic of mixed dentation analysis. So again from orthodontic this becomes really important. Last exam they gave you a Tanaka Johnston in which they gave you values and you have to calculate the correct. So for that you need to remember the Tanaka Johnston analysis, the formula, and then only you will be able to put that values to use. Okay, so coming back to this question, the people are saying option C, that is Ukaba, which is the correct answer. Okay, so as I've told, we'll move a little bit ahead from these other questions which can be formed. So Stanley Kerber is the most accurate out of this. Okay, Tanaka Johnston is most clinically useful. Moyers is most popular analysis. Fukaba is the only analysis which uses only radiographic method and no prediction charts required. Okay, so this other things which can be asked. Next is the formula of Tanaka Johnston: half plus 11 mm, half of the sum of mandibular incisors plus 11 mm, and half of the sum of the mandibular plus 10.5 mm for maxillary mandibular arches respectively, you know. Okay, so this is the formula for Kukaba's analysis. Okay, so most clinically used Tanaka Johnston, purely radiographic method, and highest prediction value or highest accuracy. Modified Stanley Kerber's of Hicksonwood. Identify the appliance. A very simple question. Even if you don't know the subject of orthodontics, you would have been able to answer this question. Any question from mixed dentition analysis, please ask. Otherwise we move towards the next question. Identify the appliance. Fixed appliance for thumb sucking. Option A, Nimisha says. Option A, Aarti, Deepa all says option A. So it's a very easy question. So yes, option A is the correct answer. A very very easy question. Looking at the options and image, you can clearly see that it's not a removable appliance. There are bands present, soldered wire present, so it's not a removable appliance. So option B and D are removed. Option A and C, fixed appliance for thumb, fixed appliance for lip. Spikes present on the palate region cannot be used for correcting lip bite. So a little bit of common sense and you would have been able to answer in the exam. That is option A, fixed appliance for thumb sucking. Quite very easy question. So some people ask me what's the difference between spikes and guard. This is the image of spikes. Guard, these are both are removable appliances. This is a removable crib. This is a fixed tongue crib. See the bands present. And this is a acrylic plate. So acrylic plate means it's a removable appliance. Okay, so these are the image. Palatal crib, this is also known as hair rakes, and this is a image of bluegrass appliance. See this roller present, another important appliance. Okay, any doubt, please ask. Otherwise we move ahead towards the next question. Okay, in this case the nasolabial angle is, again a question in which basic mathematics knowledge would have helped you out. You don't need any higher knowledge of or the subject about either orthodontics. Let's hope the questions of other subjects were more good in this November 2023 exam as compared to orthodontics. Acute, obtuse, normal, ideal. Option A, option B. Okay, so the correct answer here is option A, that is acute. Okay, looking at the options, normal and ideal are directly eliminated. That leaves us with acute and obtuse. If you look at the image carefully, you can see that the lips are incompetent, the angle is reduced because of the proclined incisors. Clearly, it is an acute nasolabial angle. The best way to judge, even if these line images are not clear for you in your exam, look at the lip competency. Okay, if the lips are incompetent, or you can say open, that means the incisors are proclined, the nasolabial angle is reduced, that means acute. Because in exam sometimes the images which come on your computer screen are not that great, so take that into account. Look at the other features. If the lip closure is there, closed lip is there, then it's a obtuse nasolabial angle. Okay, so what is a nasolabial angle? Drawn from the tangent drawn from the lower border of the nose and the tip of the upper lip, and the angle is 80 to 105 degree. Decrease with patients having proclined anterior or prognathic maxilla, increased with retrognathic maxilla or retroclined maxillary incisors like class 2 division 1 or division 2 malocclusion, sorry, and this is class 2 division 1 or bimax cases, the angle is decreased. So this is the other example based question which can be asked here. Clear? Moving towards the next question. Now at that time I got two varieties of this question, so I included both. Identify the given orthodontic appliance or the given appliance made up of night expander, nickel chromium expander, cord helix or Hyrex, nickel titanium, nickel chromium, cobalt chromium or beta titanium. So out of so I'll zoom in the image as well. So yes, the correct answer is it's a night eye expander or nickel titanium expander. So it was given by Wendell V. Arndt in the year 1993. Okay, it's a fixed removable type of expander known as SM, slow maxillary expander. It comes in 8 different sizes. So based upon the amount of expansion, you select the size and you give it. So it works on the shape memory effect, A to M transformation. Okay, you cool it down, you can modify it, mold it, insert it into patient. The intraoral temperature is slightly high, it regains its shape and expands the upper arch along to it. Okay, other types of expander, this is a fan shaped expander image. So you open the anterior screw, okay, you can expand the anterior region as well. And this is a butterfly expander. Okay, so night eye out of expansion appliances, night eye expander is the most commonly one which is asked. Okay, next fewer modifications of this expansion appliances are asked. We'll take up them in the upcoming sessions scheduled for the next few weeks. Okay, clear? To moving towards the next question, Scammons curve for the growth of 4 major tissue systems of the body. Which of the tissue the arrow depicts? Lymphoid, neural, genital, general. Deepa says option B, Nimisha says option C. Change to option D. This is the arrow. I'll zoom in the image as well. So yes, general is the correct answer. So this is the Scammons growth curve. Different organ grows at different rates, known as differential growth curve. It was given by Richard Scammon in the year 1930. Okay, the lymphoid tissue is this. So maximum growth of neural tissue is completed by 15 to 17 years. Maximum growth is completed by 6 to 7 years. H-shaped curve by general body tissue. So instead of general, they can quote examples as well, like muscles, bones, viscera, etc. Negative growth is seen in lymphoid tissue. Growth of maxilla and mandible. So maxilla follows neural growth curve, mandible follows general body curve. And in general, if they ask you about growth of jaws instead of maxilla and mandible separately, then they are closely towards general body curve. Okay, last to start growth is the genital body curve, accelerates around puberty. Okay, so these are all the questions which can be asked from Scammons growth curve. Next variety of question is the application based question. So correction or myofunctional correction of maxilla should be done first as compared to mandible. Reason being is this curve, because the maxillary growth finishes first, mandible growth later. So antero-posterior correction of maxilla like face mask therapy should be carried on first, and fin block can be carried out later as well as compared to the for the maxilla. It's because of Scammons growth curve. So this is the next variety or type of question which can be asked from this. Next question. TMJ or TMD problem does not occur in bilateral missing molars, occlusal interference from restoration, decrease VD, increased overjet. Eleventh A, a very interesting question out of the following till which we have come across until now. Anyone else if they can? So looking at the options, first of all, they're asking temporomandibular joint disorder does problem or TMJ problem does not occur. In which of the following situation it cannot occur? Options are bilateral missing molars, occlusal interference from restorations, very clear option that it will cause problem, hence it's eliminated. decrease VD, that is decrease vertical dimension, it will definitely cause TMJ problem. Very clear. That leaves us with option 1 and option 4. Bilateral missing molars and increased overjet. Now students, if the molars or single teeth are missing on both the sides, supposedly we take the option example of lower 6 or lower 7s, anything. Okay, so remember from your prosthodontic class, the cuspal height or the molars, what are they important? They are responsible for the opening or the hinge action of the joint. Whereas if the overjet is increased, it is responsible for anterior guidance. So true, if the overjet is increased, there will be loss of anterior guidance for the teeth. Whereas loss of molars, low molars, no cuspal guidance for the teeth to settle can lead to TMJ problem. So hence, out of this falling, 4 is much better than 1. True, 4 increased overjet will also can lead to TMJ problem later on, but that will also depend upon the amount of increased overjet as well. And second of all, overjet से ज़्यादा canine guidance will also help in moving and opening the jaw. So the better option is option 4A, that in increased overjet cases TMD problem will not occur. Bilateral missing molars, if molars are absent, there won't be any cuspal guidance for the jaw to open. Loss of cuspal guidance will lead to TMJ problem. That's why it's always said molars, if they are attrited or they are lost, they need to be replaced, because later on in life they can lead to TMJ joint problems as such. So very interesting and good question. Any doubts in the explanation which I offered? So next question, which of the orthodontic wires can be bent multiple times without fracture? Stainless steel, cobalt, chromium, nickel titanium, beta titanium. Good question, but easy direct question, much better than the ones which came in the starting of the session. So questions like these, where you need to think or pause, best is to go ahead with the rule of elimination, like the way I proceeded in the previous question. Coming back to the previous question, supposedly you're not able to eliminate out of 1 and 4 option as well. So think retrospectively. Increase overjet means situations like class 2 malocclusion. So have you seen a patient with class 2 malocclusion having TMJ problem or joint problem? Whereas bilateral missing molars or loss of molars, most commonly patient comes to your clinic with the problem multiple times headache, joint problem like that. Okay, headache is the most common cause linked with loss of molars. Okay, so you can think retrospectively like that as well. So coming to this question, which of the orthodontic wires can be bent multiple times without fracture? Nimisha says option 3. This is the problem with online based teaching. I'm not able to solve or get into the mind of the students so that how are they able to arrive at a particular option so that I can correct them. No one? Anyone else? So coming to the options, can be bent multiple times without fracture. Stainless steel, cobalt, chromium, nickel, nickel, titanium, beta. If I don't know the subject as well, I can eliminate nickel titanium directly because it cannot be bent at all. Night-time wires cannot be bent, so that option is eliminated. Beta titanium, if you bend it once only, it fractures, so that is also eliminated. Stainless steel and cobalt, chromium, nickel, also known as alloy wires. So the evolution from SS to alloy occurred. Why? Because stainless steel had good fracture resistance but decreased formability, that you cannot give it into desired shape. A lot of effort needs to be taken. So that's why taking up that strength but increasing formability, these alloy wires came into being. So how do we do? Alloy wires are quite soft. You bend them into desired shape, heat it, they become stainless steel. All the properties of stainless steel are exhibited by them once you heat treat them. Okay, so they can be bent multiple times without fracture prior to heat treating. Once you heat treat them, they cannot be bent anymore. They become stainless steel wires. So the correct answer is cobalt, chromium, nickel or alloy wires. Okay, nickel titanium cannot be bent. Even if you forcefully bend it, the wire will break. Okay, they come in preformed desired shape and cannot be bent. So very poor formability, excellent shape memory with nickel titanium wires. Same goes for beta titanium. Good shape memory, good spring back quality, but less fracture resistance. SS, alloy, very good fracture resistance. Any question? A question from dental materials but related to orthodontic wires, so I took up in my session. Any doubts regard to November 2023 exam paper? So my best wishes to you all. My strategy, my advice for you now is, in this last 4 to 5 weeks before your exam, solve 2 to 3 full course tests. I don't know how many of you are DAM students or are from other institutes joining us for this live YouTube session. I'm not saying any particular test series of any particular institute, but full course test should be given in the same time and same format pattern now per week till your exam. If you leave them till your last minute, you won't never be able to cope up with the pressure of handling all 19 subjects in full 3 hours. Same pattern, same everything, same time duration, these tests should be given. If you haven't started, 2 to 3 subjects revision per week. That includes your class notes, your PYQs. next few weeks are going to be full of festivals, full of distractions. If you can keep your mind focused, your result will itself become a festival for you to celebrate. These festivals will come up every year. Two exams will also come up every 6 months for INI exam, but the lost time can never be regained. Okay, so my advice, get away yourself from distractions, focus on the last few weeks or months which are remaining for your exam and give your best shot. And next, don't give a half-hearted attempt. First of all, exam dena hai sabne, those who are eligible for this INI exam, November exam, and do not give a half-hearted attempt that I'm only prepared for X so and so number of subjects, that's why my marks are very good out of this. No, exam is of 19 subjects. Every exam, be it NEET, INI January session and INI July session. So if you're thinking that I'm only preparing for this many subjects and giving exam based on that and evaluating yourself based on that, then you're fooling yourself only. And do not skip the exam if you're eligible. That I'm not prepared, because no one is prepared any day. Even if some of you score a first rank in your exam, post exam, if I ask them in your interview, do you think you're prepared now? No one will say I'm prepared, I'm done, was done with my course. Okay, no one can say that, because the knowledge is vast, the information is vast, and it keeps on adding, evolving with time. So no one can claim that their course was complete, they were well versed with the subject. Okay, exam, it takes time. Okay, so give your full attempt, give your full hearted attempt, and any doubts, you know where you can reach me. Any topic related to orthodontics, I'll be happy to answer. I don't ask anyone where is from which institute, anything like that. Any doubts and related to subject orthodontics, any topic, anytime can be asked, I'll definitely respond. Okay, you know very well where to reach me. Okay, please study, do not hesitate to ask your doubts. Okay, thank you so much for those who are joining and taking out time from your schedule to join the session. Thank you so much. Any doubts can, otherwise I'll end the session.